Welcome to our training session on basic health and behavioral needs. Basic health needs: nutrition and hydration, personal hygiene, adequate sleep and rest, exercise, safety, medical, use and care of adaptive equipment. Nutrition and hydration. Follow diet, consistency, special diet restrictions, in conditions like diabetic, dysphagia, no teeth, etc. Monitor eating patterns for changes and report as needed. Encourage independence in eating. Offer water at meal times. Encourage hand washing before eating. Use correct positioning for eating. Personal hygiene. Bathing, privacy, safety, water temperature. Oral hygiene, brushing, flossing, adhere to teaching strategy. Nail care. Reporting and documenting of changes. Hair care. Appropriate dress. Neat, clean clothing. Adequate sleep and rest. Report any changes in sleep pattern. Report increased lethargy or increased activity during the day. Exercise. Mild exercise, even for people in wheelchairs. Benefits of exercise include increased metabolism, energy, better sleep and mood, and pain relief. Aerobic exercise needs an OK from the MD. Safety. Equipment should be in working order. Check each time before using. Side rails, safety belts are also important. Secure medications, cleaning products. Know whereabouts of individuals at all times. Medical. Doctor follow-up should be done as needed. Follow all doctor orders and treatment plans. Notify nurse of changes in health status. Adaptive equipment. Safety, safety, safety. Eyeglasses should be clean. Hearing aids should be functioning. Monitor for problem areas. Wheelchairs. Vans. Walkers. Signs and symptoms of illness. Signs of illness are objective, in other words, what you observe. An example of what you see can be rash, what you feel can be a lump, what you hear can be cough, and what you smell can be urine or sweetness of breath. However, symptoms of illness are subjective, in other words, what is reported. An example could be that a person says, "My head hurts." 911. When to call 911? Call when there are situations like chest pain, seizure outside of protocol, falls, etc. When not to call 911, no need to call during normal activity or when there is minor injury. Communication. Communication is the most important thing we can do to ensure the health and safety of our individuals. Also important are documentation, reading the communication book, speaking to coworkers and supervisors, as well as asking questions. Medical awareness. Policy No. If.po. 048, subject, emergencies in the home / reporting individual problems. Policy statement. All staff members must report identified clinical problems to appropriate persons. Document their findings and any actions taken. Individuals' problems are classified as extreme emergencies, moderate emergencies, or minor emergencies. An extreme emergency may be, but is not limited to, unresponsiveness, except in a known comatose consumer. Severe chest pain with diaphoresis, nausea. Radiation of pain to neck or arm or cardiac arrest. Signs and symptoms of hemorrhage or acute bleeding, GI. Vomiting or diarrhea. Extreme respiratory distress, duskiness with impending arrest. Initiate CPR if no MD orders or DNR in place to prevent it and individual status indicates code. In the event of an extreme emergency, call for emergency transfer to hospital immediately. Call physician. Stay with the individual until emergency medical personnel arrive. Document exactly what happened on the visit slip. Appearance of the individual when first seen by agency personnel on the day the emergency was discovered and all steps and actions taken. Complete verbal orders for transfer. A moderate emergency may be, but is not limited to, change in pulse, such as thread fins, irregularity, tachycardia, or bradycardia. Blood pressure with systolic less than 90 or diastolic greater than 110, shortness of breath with dusky appearance, change in breath sounds. Decreased urinary output over 24 hours. Blood sugar via glucometer greater than 250 or less than 60, or anything abnormal for given consumer. Vomiting or diarrhea with potential for dehydration. Temperature higher than 101 degree. Signs/symptoms of infection of wound or decubitus not previously identified. Fall with suspicion of injury. Medication irregularities, i.e. questionable dosages or potential interactions between medications prescribed. In the event of a moderate emergency, stay with the individual until you are satisfied that appropriate follow-up has been initiated. Call the office and report to the person taking your call that this is a moderate emergency, and the name of the patient. Call the physician if directed to do so. Document exactly what happened on the visit slip. Appearance of the individual when first seen by agency personnel on the day the emergency was discovered, and all steps and actions taken. Complete any verbal orders which may have been received. A minor emergency may be, but is not limited to, fluctuation in vital signs, which are not life-threatening. Medication irregularities, i.e. questionable dosages or potential interactions between medications prescribed, but individual is in no immediate danger. Complaints of pain, weakness, diaphoresis, upset stomach. Unexpected weight loss greater than 5 pounds, UTI, GI symptoms indicating impending illness. Falls without apparent injury. Change in wound or decubitus size. In the event of a minor emergency, call the office. Document exactly what happened on the visit slip. Appearance of individual when first seen by the agency personnel on the day the emergency was discovered and all steps and actions taken. Complete any verbal orders which were received. It is not necessary to stay with the individual until resolved, except see below. Note, as with all written guidelines, certain situations do not fit the criteria listed. When unusual situations occur, do not hesitate to call the office and/or nurse on call for advice. If you call the physician, report the conversation and any change to the plan of care to the supervising therapist as soon as possible. Also, remember to document the situation thoroughly as soon as possible on the visit slip and clinical record. Be aware that individuals living alone or those without responsible family/caregivers present may need to be attended to until resolution is met. Challenging behaviors. Challenging behavior is an action or series of actions that negatively impact the person performing the action and/or the property and people involved. Rights, when everyone is viewed as equals and given opportunity to exercise rights, less incidents of problematic behavior occur. Behavior event sequence. Antecedent, setting events and/or environmental conditions that happen or are present before the person performs a behavior, noise, injury, heat, being ignored, etc. Trigger, events that directly activate the behavior, getting hit, being yelled at, bumping into something. Consequence, desired or undesired event that occurs after the trigger. and as the result of a behavior, getting attention, gaining something, getting hurt, etc. Why do people with intellectual disabilities may have challenging behaviors? That is a good question. It is not exclusive. Just because they have an intellectual disability does not mean they will have challenging behaviors. Possible causes of challenging behavior: fewer freedoms, restricted control, few mentally healthy activities, victimization, prejudice, communication of needs. People with disabilities may not have the ability or opportunity to properly communicate their wants, choices, emotions, discomfort, or pain. Challenging behaviors. Problem behaviors occur when needs, such as medical, basic needs, medications, are not met. Examples include illness, injury, pain, hunger, thirst, sleep, too much, too little, wrong medication, wrong time. What to rule out: psychological, boredom, learned behavior, displaced anger, death or similar loss, need fear attention, overstimulation, diagnoses. Environmental, too hot or cold temp, too much noise. Unhappy with home life, overcrowding, work dissatisfaction, negative interactions with others. Caregiver behaviors that can cause challenging behaviors: poor attitudes, bad morale, being fearful, overprotective styles, poor communication, dehumanizing attitudes, use of force or threats, denying personal space. Clothes and fragrances can be triggering. Changes to take note: verbal changes, abnormal stuttering, rapid or angry speech, cursing out of the norm, unusual loudness, unusual silence. Behavioral changes, excitement, withdrawal, irritability, pacing. Person-specific, rocking, humming, twirling, staring, etc. Physical changes, rapid or heavy breathing, expanded veins in face, forearms, neck, red/flush face, clenched fist, quivering muscles. Changes in facial expressions, body stance, rigid or tense. Functional Behavior Assessment, FBA. First, describe the behavior clearly. Second, note the events, times, and situations that predict the behavior. Last, find the consequences, reinforcers, that maintain the behaviors. Other factors, input from the person and their support. Symptoms and behaviors. Dislikes, likes and preferences. Warning sign and triggers. Addressing behavior at every stage. Calm state, develop good rapport, review the person's plan, reward appropriate behavior with attention, watch for warning signs, treat with dignity. If warning signs present, stay calm. Check room for safety issues and clear exits, follow plan, give firm but fair direction, redirect to a safe activity, help resolve issues, allow personal space, make coworkers aware. Successful ways to change behavior: model desired behaviors, reinforce positive behaviors, provide consistency with feedback. Unsuccessful ways to change behavior: intimidation, bribery, punishment. Thank you for watching Basic Health and Behavioral Needs module. Please answer the questions for this training before moving on to the next training module.